Now, KXAN Austin News Today.
September is Prostate Cancer Awareness Month. This cancer is the most common cancer among men, the second leading cause of cancer death in men. Needless to say, it's important for you to get the facts. We have our own Dr. Koushik this morning to give them to us. Good morning.
Hey, good morning, Jenny.
So let's talk a little bit about prostate cancer. You hear a lot about getting screened for it. You see commercials. What is a prostate exactly, and what is prostate cancer?
So a lot of men will say prostate's just there to bother them, but it's a walnut-sized gland, lives right below the bladder, and it's part of the urine tube, and it's basically secretes a lot of the chemicals that are in the ejaculate when you're younger. As you age, the prostate continues to grow and surrounds the urine tube and starts to pinch it, causing a lot of the typical problems with pushing and straining to urinate. And then finally, in some people, as we get older, there's a higher risk of developing cancer in that prostate gland.
Are there symptoms? You said it pinches it, so will people notice some discomfort when they're going to the bathroom or something? Is that what should clue them in?
Well, there's a separate entity called BPH, or benign prostatic hyperplasia, so it's not necessarily cancerous, but it's also a sign of cancer or just benign enlargement of the prostate. As it squeezes on that urine tube, it starts to cause you to have to push and strain to urinate, failure to empty your bladder completely, things like that.
And what is a PSA?
So a PSA is a prostate-specific antigen, and basically it is, like the name says, specific to the prostate, and it's a chemical secreted by it. It increases as you age. It increases if you have infection in the prostate, but it can also increase with prostate cancer.
How common is this disease? Is this something that many men need to be worried about?
Well, like you said, right after skin cancer, it's the second most common cancer in men. 1 out of 7 men will be diagnosed with prostate cancer in their lifetime. 250,000 of people a year will be diagnosed, and about 35,000 men will die of prostate cancer, unfortunately, each year.
At what age should you start getting screened for it?
Well, most people are going to start getting screened at the age of 50. However, if you have a family history of prostate cancer, are African American, and some Hispanic populations, you should actually start beginning your screening at the age of 40, so 10 years earlier for those people in high risk.
So it's definitely not very common unless you start getting up there to middle-aged years.
Exactly.
How treatable is it?
It's actually quite treatable, and the great thing about prostate cancer is that 9 out of 10 diagnosed men with prostate cancer have localized prostate cancer. So the key is, if you're caught early, you can be treated and you can hopefully be rendered prostate cancer free.
All right, very good information, and this is Prostate Cancer Awareness Month, so it's a good opportunity to look it up and go get screened if you haven't gotten screened yet, and it's definitely important to catch it early. Thanks so much for joining us.
Thank you very much.
Thanks for joining us this morning. Well, we'll be right back with an update on your forecast. Stay with us.